I thank all my subscribers for giving me the wishes and congratulations on successful completion of 1 year of my YouTube channel. After successful completion of Science in Radiology Set 1, Set 2, we will try to see Science in Radiology Set 3. Coming to the first case, this is a child. The patient complained of headache, vomiting and seizures. You can see there is a lesion noted in the periventricular location on left side, which is showing central necrosis, which is surrounded by calcifications, which is typically seen in the form of centripetal type of calcifications, and surrounded by cystic areas surrounding the centripetal type of calcifications. These are the also, you can see these are centripetal type of calcifications, central necrosis surrounded by tumoral cysts, and these are the axial sections, and this is the coronal sections. So this is the central areas of necrosis, and these centripetal areas of chunky calcification resembles the petals of the flower, and these tumoral cysts nothing but resemble the leaves. So this is a classical case of supratentorial ependymoma, and this is the periwinkle appearance or periwinkle sign. This is the periwinkle flower. So you can see the central necrosis is the central part of the flower. Centripetal calcifications are nothing but the petals of the flower, and the peritumoral cysts nothing but resemble the leaves of the adjacent to the flower. So this is classical periwinkle sign in supratentorial ependymoma. So remember periwinkle sign in supratentorial ependymomas. Next case, you can see there is a hypodense lesion with multiple calcifications noted in the Clival region, which is even extending into the prepontine cistern. There is even the destruction of the clivus. Here on the sagittal T2 weighted images, you can see there is clearly lobulated hyperintense lesion, typically noted in the Clival region with destruction, and is also extending into the prepontine space with indentation noted over the pons. So this is nothing but typical thumb sign. Remember thumb sign in Clival chordoma, where the tumor indents the brainstem in the mid-sagittal sections. This is the thumb sign. And also remember other thumb printing sign which is seen in ischemic bowel disease, and thumb print sign in epiglottitis. So remember thumb sign in Clival chordoma. Next case, you can see this is a patient presented with pain in the orbit, and there was a previous history of trauma. You can see there are thick echogenic layers, echogenic rim noted in the periphery of the orbits, symmetrical thick echogenic layers or rim noted in the periphery of the orbit. And here you can see there is a CT where there you can see there are hyperdense areas, hyperdense linear areas in the choroid with subchoroidal collection on subchoroidal collection. So this is a classical case of choroidal detachment. So this is the choroidal detachment, and this is the choroidal detachment. It is not a retinal detachment because retinal detachment will show a V-shaped layer, detached membranes which are attached at the optic nerve head. So this is a classical case of choroidal detachment, and this is nothing but kissing choroid sign in choroidal detachment. But a new terminology, a new appearance I want to frame for this case is nothing but baseball appearance. So typical this orbit with choroidal detachment resembles the baseball. So this is nothing but baseball appearance or sign in choroidal detachment. Remember kissing choroid sign and baseball appearance or sign in choroidal detachment. Next case, this is a case of supraspinatus tendon tear. You can see there is a supraspinatus tendon tear. There is collection noted in the even in the rotator cuff extending into the subacromial recess, even oozing through the acromioclavicular joint space into the supraclavicular fossa. So this is the case of early case of supraspinatus tendon. But in sometimes in chronic case of supraspinatus tendon tear, there will be degenerative changes, and the fluid from the rotator cuff will expel through the acromioclavicular joint space into the supraclavicular fossa, presenting as a swelling in the supraclavicular fossa. Then it is known as Geyser sign. So Geyser sign is nothing but orthographic contrast or joint fluid from the glenohumeral joint escaping through the acromioclavicular joint space and presenting in the supraclavicular region as a collection, or in the subdeltoid region as a collection. So this is nothing but Geyser sign in shoulder, seen in case of chronic supraspinatus tendon tear or long-standing rotator cuff tears, and even in advanced degenerative changes of shoulder. Thanks to Dr. Kusuma Latif and Dr. Veen Nematar sir contributing this case. Next case, here you can see this is the axial view of the patella. The patient complaining of pain while walking. You can see there are small linear structures running perpendicularly, placed perpendicular to that of the patellar surface. Here you can see this typically mimics the teeth nothing but when you see the close projections or magnified view of this patella, you can see these are nothing but resembling the teeth. So this is nothing but called patella tooth sign, which refers to vertical ridging of the patellar insertion. These are vertical ridging of the patellar insertion of the quadriceps tendon, which can resemble dentate structures or teeth. So this is called as patella tooth sign. Next case, this was a case of dengue Here you can see there is a hyperintense signal in the basis pontis, predominantly in the peripheral location, which mimics reverse mustache appearance. So, and which is low on ADC. So normal, this is the normal mustache appearance, but here this is nothing but called the reverse mustache appearance, which is classically seen in dengue. So this is a case of dengue, and thanks to Dr. Mehta A. Mahal RR, where you can see this journal where there is a classical reverse mustache sign or appearance in dengue. And also remember, there is other appearance in dengue where you can see there is a restricted diffusion AWI noted in the palatal thalami with hemorrhage. This typically remembers the double doughnut appearance. So remember, reverse mustache appearance and double doughnut appearance both seen in dengue and this is a journal. You can see this journal, Kumar AS, that is, and Mehta S in Neurology of India. Both these journals are from Neurology of India. You can refer them. So remember, reverse mustache sign and double doughnut appearance sign both in dengue. Next case, you can see this is a female. This presented with vomitings and hypertension. You can see there are hyperdense folia with hypodense edema noted in between the hyperdense folia. Here you can, these are the hyperdense folia, and also you can see there is hyperdense collection or hemorrhage in the folia. So these alternative layers of hyperdense folia with hypodense edema typically mimic the skin of the zebra. So and also this is other case of MRI where it was diagnosed as spontaneous intracranial hypertension with dural tear. You can see there are blooming of GRE, blooming on GRE noted in the folia. So typically mimicking the hemorrhage with adjacent edema. So this is classically nothing but called as zebra sign. So zebra sign seen nothing but this is layering of blood in the folia in cerebellum. It can be seen in supratentorial surgeries or temporal lobe resection, neurovascular neck surgeries or lumbar spinal surgeries. So remember zebra sign in remote cerebellar hemorrhage, and also remember zebra stripe sign, which is seen in osteogenesis imperfecta cases which are treated with cyclical bisphosphonate therapy or pomidronate, where there you can see horizontal lines in the metaphyseal region of the long bones, especially in osteogenesis imperfecta case. So remember zebra sign in remote cerebellar hemorrhage, and remember zebra stripe sign in osteogenesis imperfecta cases treated with cyclical bisphosphonate therapy. Next case, you can see this is a case of TB meningoencephalitis. You can see there is the enhancing basal exudate in basal exudates noted in the perimysian cisterns and basal cisterns with few left meningeal enhancement, and also there is associated hydrocephalus. So this is classical mimicking the spider leg appearance. So remember spider leg appearance or enhancing basal exudates and in TB meningoencephalitis, and also remember spider leg pilogram in polycystic kidney disease. This is also a new sign that is called worm sign, where you can see a cortical ribbon-like structure which is detached from the skull and seen in the anterior hemisphere, which is typically seen in early scans. Whenever you see a worm sign, please follow up the case to rule out impending hemorrhages in the latter trimester. So remember, this worm sign in fetus is a new sonographic marker where we have to close follow up the case to rule out impending hemorrhage in the latter trimesters. So this is that worm sign. Remember worm sign. This cortical mantle mimics the worm sign. Next case, you can see this is the last case. Here this is a case of non-accidental trauma where you can see there is a bridging vein thrombosis. This is the thrombus of the bridging vein with the hemorrhage at the end of the bridging vein. This typically mimics the tadpole. So this is called as tadpole sign in bridging vein thrombosis seen in non-accidental trauma. This also mimics a lollipop. So remember, tadpole sign or lollipop sign in bridging vein thrombosis in non-accidental trauma. However, also remember lollipop sign is classically seen in radiology in hepatic epithelioid hemangioendothelioma, where you can see these are the hepatic veins or portal veins. This is the portal vein which is terminating in the hypodense area or hypoenhancing area with central avascular core, which is seen on CT and MRI. Typically, this lollipop sign is seen in hepatic epithelioid hemangioendothelioma. So remember tadpole sign or lollipop sign in bridging vein thrombosis in non-accidental trauma, and also remember lollipop sign in hepatic epithelioid hemangioendothelioma. Thank you all.